Have you ever used cannabis for something related to mental health? If you're a cannabis consumer, there's an 85% chance you have. Today, we're going to talk all about it. Today, I'm here with Clifton Uckerman, a licensed clinical social worker, and really the professional that we work closely together with patients on mental health, PTSD, and anxiety, depression. Clif, start right from the beginning. When you see a patient, what's that evaluation like?
So can we back up?
We can back up all the way to the beginning.
To the very beginning.
Yeah.
When you and I met, I was looking at my phone and had your voicemail still on my phone from, I think, 2020.
2020, yeah.
And so I think you were really seeing a need with your clinics, helping people get medical cannabis card for the mental health component for PTSD, getting that, assessed and used as a qualifying condition. So my question to you is, what kind of need did you see?
Oh, with physical conditions, especially the limited physical conditions that are allowed here in Utah, there is always a associated behavioral health or mental health piece, right? Mm-hmm. And there's a real lack of integration between the traditional kind of quote unquote prescriber medicine that I'm used to and I was trained in, and an integration with what you do in really that behavioral therapy, working through those things for patients. So I really felt like there would be a huge benefit to patients to have you involved, especially somebody who was keen on using cannabis as a way to augment therapy. Because there's so much about spirituality and cannabis use and all these things that really go together.
And so when you and I first met, I was running a clinic where we were cannabis friendly, or at least trying to be because of the new legalization, but we weren't really cannabis affirmative. And I knew that a lot of my patients at the setting that I was at were using cannabis for lots of different symptoms: anxiety, sleep, digestive, gastrointestinal problems, nausea, headaches, migraines. And the type of therapy that I was doing with them was so trauma focused. At the root of all that was probably some good PTSD, and being untreated and just not being adequately addressed with the medical cannabis in conjunction. So here we go. You and I met. We started kind of talking. I really appreciate that you kind of saw the need and the value for bringing the mental health component in. And so when a patient now comes to meet with me at UTTHC, I'm looking at all of the symptomatology: anxiety, migraines, headaches, nausea, sleep problems, and I'm looking through that right into a PTSD diagnosis. Chances are, most, if not all, is some kind of rooted trauma that's never really been adequately expressed.
They really do fit together, and it seems like you were seeing this from the opposite side, right? You were seeing patients from the behavioral health side that were expressing physical symptoms too, that needed this integration of both of our worlds. So talk about how that goes with this cannabis affirmative therapy.
Yeah. So we do the assessment, we look for the PTSD, we make the diagnosis, so it's a formal diagnosis so that they can get their medical cannabis card. But we have one step before they can get to the dispensary, and that's going to see you as the QMP.
So once somebody would come from you with an official PTSD diagnosis, then it gives us the opportunity to go through all of their medical history, their surgical history, all of that, kind of quote unquote normal stuff you'd go through with your primary care provider. We do a lot of history taking in that assessment and evaluation, focused a lot on medications that they're taking and how cannabis is then going to interact with those medications, what changes we might want to recommend for them with their regular medications, or what they can look forward to A lot of patients will come into us on a benzodiazepine for anxiety if they have a PTSD diagnosis, or they're on an antidepressant. We don't usually change those up front. We're going to design a program where they can learn to take it, learn what it feels like to be high, right? Learn to use that as a tool in their behavior. So we're trying to figure out if they qualify, which they would do. We'll get them through the state system, which is a little cumbersome, right? Take some walking through that program. And then once they have their card, they're able to go to the pharmacies, the dispensaries, purchase some products. We try to keep it very, very simple. CBD, THC, maybe a little other cannabinoids in there, low dose, keep the anxiety lower. And then we want people to come back to you, right? Once they've kind of given them a chance to learn what it feels like to use it, and then here they come.
Yeah. Now here's where we really get cannabis affirmative, because now they've been to the dispensary, they have their dosing regimen, they have their product, they have their medicine. It's important for me as their therapist doing trauma-focused work to actually know what they're taking, how much they're taking, in what ways they're taking it. And then I want to know how soon before therapy they're taking it, and then what they're going to be taking after therapy. And so we develop a trauma-focused treatment plan, which really affirms being able to use their medicine before and after therapy. Now, if they're using it before therapy, what that's doing, it's going to get them calmed down. It's going to get their central nervous system. Typically, their central nervous system is on fire with all the trauma.
Yeah.
And so we talk about, okay, what are you going to do before session to help you calm down, to relax a little bit, to get yourself in a place where you can come and really talk about memories, traumatic experiences, really negative life events that have impacted and affected you the most, that you've never really been able to process before. And then what are you using that's going to then help us to kind of unpack or pull out that shame molecule that usually gets stuck inside the trauma memory. And when they're using cannabis in that way, it can really lighten things up, soften the mood, and then lubricate the experience in the therapy session so that they can do all that work and have the emotional release that comes with it. And then what typically happens is after the therapy session, a strong emotional release and unpacking all this trauma and really facing that internalized shame that a lot of people carry because of those negative life experiences is going to increase anxiety. And then the anxiety is going to then disrupt sleep. So I want to know, what are you now going to use after the session to manage the anxiety so that it doesn't flare up to an unmanageable level? And then also on top of that, what are you going to layer in to help you get a good night's rest because of the emotional expression and all the trauma work that we're doing? That's like going to the gym and exercising, tearing down some of those muscle fibers and stretching and tearing some of that muscle tissue. The brain is a muscle, and the same thing happens when they're doing all this work, talking about all this stuff, emotionally releasing. And so the sleep is so important because it's during the sleep that their brain begins to repair itself by being able to essentially, reprocess things, go into a dream state, and have the rest that they need. They can wake up, and because of neuroplasticity, their brain has been able to kind of prune all of that old kind of, all of those old pathways that was holding on to all of that old memory, and then they can wake up just feeling, like a whole new person, essentially.
I want to unpack this just a little bit more even, because you're describing people dosing before therapy and then coming in. So what we know about the cannabis, the plant, how it acts on the brain, is there are, especially in trauma and PTSD, there are calluses that form between the emotional part of the brain and the frontal lobe. And these pathways become literally calloused in the brain. Cannabis has been shown to essentially soften those calluses so that when they're doing the work, when patients are doing that work, it's more plastic. It's more, and plastic's not a great term, but it's more clay-like, right? So you're helping people mold that. Certain strains might be better than others for that type of thing. Strains that would enhance creativity in the brain, but not strains that increase anxiety. So high THC without CBD might not be a great option for patients. Good balance of cannabinoids, CBD and THC, have found to be really good in those types of things. And then when you talk about at night, that recovery, moving to an oral method, something that's long-lasting for sleep with CBN, CB nighttime as I call it, because it's easy to remember. It's nice, it's anti-anxiety, and it helps people sleep, mixed in with a little THC, can be really helpful for those the patients at night. So they might be using a different method of delivery and product during the day for their sessions, and different again at night.
Right. And that's what my patients love about you as their QMP is that, they come back and they say, well, Tim has told me that higher levels of CBD and lower amounts of THC is going to be most beneficial while I'm in therapy. And so I just get to kind of monitor that that's what they're going to be doing while they're doing their, working on their trauma. So it's across the board with all of the patients when they're doing trauma-focused work. When you're telling them, hey, look, do more CBD and less THC, and that's what they end up doing, especially for patients that have really never had a relationship with cannabis, or that maybe, that psychoactive high effect is just a little bit too much for them. That does seem to kind of hit the right spot for them.
It's so nice to hear that this type of thing for patients is coming full circle and that they're getting the help they need. If you or anybody that has an experience with therapy and cannabis, we really love to hear about these stories in the comments. We also do a podcast, Utah in the Weeds. You can subscribe to that to hear specific patient stories about how cannabis is influencing people's lives. And stay subscribed if you like this content and you want to hear more about trauma-based therapy and using cannabis for mental health conditions.